Great messages there. Really looking forward to seeing those folks as well as all of you at Pinnacle back with us all in Phoenix next year. Now it's my pleasure to introduce the NEMSMA annual membership meeting. NEMSMA is a professional association of EMS leaders dedicated to the discovery, development, and promotion of leadership excellence and management in the profession, regardless of system model, organizational structure, or agency affiliation. I'm going to hand the reins back over to NEMSMA President Brian LaCroix to kick off this year's meeting. Brian?
Well, thank you, Anthony. Very much appreciate the relationship that we enjoy with Fitch & Associates and MedServ. And so with that, I'll just get us started here. I'm Brian LaCroix, President of the National EMS Management Association. I want to welcome you to this virtual meeting. We've obviously never done it in this platform before. It would be an understatement to say that 2020 hasn't been a year of unprecedented and frankly unpredictable events. So that's why this membership meeting this year is coming to you in this platform. Usually we are together at Pinnacle, and we'll look forward to doing that again in 2021. But I want to thank the MedServ group, part of the Fitch portfolio, and I also want to thank the Kentucky Board of EMS, where Mike Pointner and Chuck O'Neill have helped us plan and prepare for this meeting. So we've got a summary presentation for you today. It'll be about 1 hour, perhaps a little less. We'll be hearing from some of our board members about the activities of the association. Opening remarks will come from Dr. Jay Fitch from Fitch & Associates. And I want to offer up an acknowledgement that this year's actually been a pretty darn good year for NEMSMA. I think that we are figuring out how to be the organization that can best serve our members, how to narrow our focus, provide support and leadership for EMS leaders across the country and aspiring leaders as well. We want to help make your world a bit more informed, perhaps, maybe a bit easier, and perhaps a bit more fun. And I have to acknowledge this has not been a fun year. This has been a really tough year. We got a lot of stuff going on. We have organizations in our membership that have reported very challenging times in terms of patient volumes. In some cases, patient volumes have dipped down at the beginning of the pandemic by 40%. So you got to scratch your head a little bit about that. You know, you wonder if people just wanted to stay out of the healthcare system and not expose themselves to potential risks. But I also can tell you that a lot of our agencies have told us that their volumes have crept back up to near normal levels, or even in some cases higher levels, based on the interfacility work that's been done related to COVID patients being moved around in various systems. So I offer my encouragement and support for all of you that are battling through all of this. I really encourage you to engage now more than ever in our association. And I think it's really important that we are supportive of one another and just be there for each other right now. So in this annual meeting membership, you'll be hearing from some of our board members about our past year's activities. Dr. Jay Fitch, as I mentioned, will open up with some comments, some words of wisdom and encouragement. And then our closing commentator is Dr. Anthony Fauci. And I wanted to let you know the backstory of this because it's kind of funny. When we were planning this presentation, we talked about trying to find, maybe a VIP type speaker that could offer some comments, and Dr. Fauci's name came up. And so I just, not knowing how to connect with him, I went to the NIH website and just looked for his contact information, which frankly had been wiped clean. If you go there, there's no email, there's no phone number, there's no assistant information, nothing. Understandably so, right? He's got a lot of plates spinning, he's a busy guy. But his staff had their emails listed there. And based on the format of their email, I just took a guess at what his email might be. So I sent him an email. And to my surprise and delight, it was like an hour later, he wrote me back and said he would be happy to address our membership. So he will be our closing speaker. He sent us some pre-recorded comments, and it's just really cool that he did that. Our secretary, Brooke Burton, will be giving a report about the recent election where we had 3 of our existing board members reelected. And then we also had a new member elected to the board, Chris Montera, and we're delighted to have Chris join us. Jamie Shebra will then also, our board member, Jamie, will summarize the activity of our committees over the past year. So more to come. Again, thank you for being here. I appreciate that very much. And Matt, I'll hand it back to you. But thank you to all of you that are listening in today. I'll be back a bit later.
Well, 6 months into the pandemic, there really still aren't words to adequately describe what EMS agencies are going through right now. It's important to take a moment to simply say thanks and to reaffirm appreciation for NEMSMA and for your personal leadership within the EMS profession. You know, EMS continues to be the tip of the spear in dealing with COVID-19 and caring for your communities, your caregivers, and your own extended family can be exhausting. So thank you for your continued dedication and perseverance. Well, we'd all like to get back to normal, no matter how hard we wish that we could wave our magic wand and make that so. We can't. So we have to continue to work and live under the extremely difficult conditions we're presented with. So one of the ways we get through a crisis is to turn to our colleagues for support. And this is one of the core reasons why NEMSMA was created and remains so important today. Whether you access the listserv and pose a question, let someone know of an issue you've had, or ask advice about a product or service, it's through those NEMSMA relationships that help us keep our equilibrium as leaders. And as you meet virtually today, we're reminded of how nice it will be to come together and shake hands and enjoy each other's company and work together next year to solve our profession's challenging problems in the future. You know, we've experienced disruption, distraction, division, and demoralization in recent months. And to avoid further decline from those 4 D words, I want to ask you to focus on a C word and an L word. The C word is culture. The L word is leadership. My wish for you is that you focus on culture and leadership by leading from the front lines. Gown up, climb onto a truck to show your support. And if you can't do that, take some extra time to visit stations and encourage your caregivers. Wear a mask anytime you're in public. Lead by example. My best personal regards and wishes for your good health. I hope you have a very productive meeting.
Well, thank you. We're so appreciative of those comments from Dr. Jay Fitch from Fitch and Associates and MedServ, the agency who does our back office support for NEMSMA. So now I just want to transition and offer up the mic to Sean Caffrey, the president-elect of NEMSMA. Sean.
Hey, Brian, thank you very much. And to everyone on the call, thank you for sticking around for the NEMSMA annual membership meeting. It's a pleasure to join you live today from my backyard here in Colorado. As dictated by the interesting times of our global pandemic, you will see a number of clips about the recent activities of NEMSMA, followed by closing comments by Dr. Anthony Fauci. If we haven't touted that enough times, that'll happen 2 or 3 more. Much like the evening news nowadays, I would ask you to enjoy the variety in the background, enjoy a few technical difficulties, and keep an eye out for a family pet marauding by on the screen. As the president-elect of NEMSMA, I am honored to have been chosen by the board of directors to lead this organization in 2021 through 2023. As a member of NEMSMA since 2008 and as a board member since 2010, I can't stress enough that NEMSMA is about the power of a professional relationship and a professional network. The relationships you can build as a NEMSMA member make you more effective as an EMS leader and bring you the wisdom of an entire community of like-minded professionals. You can also further validate your knowledge and skills through our voluntary certification program overseen by the American College of Paramedic Executives that you'll hear more about. NEMSMA is a big tent organization. We welcome members from all types of EMS services. While I come from a rural, small call volume, hire-based EMS agency that utilizes both paid staff and volunteers, I appreciate the opportunity to connect with colleagues from private, hospital-based, and third service organizations. NEMSMA is also about partnerships. Partnerships are another element of a successful network. While we focus on leadership development and credentialing, our relationships with the Pinnacle Conference, national EMS media partners, and other EMS associations are key to advancing our work. If you are a NEMSMA member, we appreciate your support and we welcome your feedback to help us better serve you, the EMS leader. If you are not a NEMSMA member, we invite you to join us and visit our website at www.nemsma.org. With that, enjoy the rest of our annual meeting. Stay safe, continue to serve your communities as we progress through the great pandemic of 2020. And I look forward to seeing all of you at the Pinnacle Conference in 2021. Thanks, Brian.
Thank you, Sean. You just reminded me that I just shared a image on Facebook. It's a cartoon that says if 2020 were a cartoon, it would be entitled Liver and Onions. So that's, we'll just leave it there. So we'll transition now to our treasurer's report from Allison Bloom, our treasurer. So Allison, take it away.
Hello, NEMSMA members and guests. I am your treasurer, Allison Bloom, and I'm here to present the annual treasurer's report. It is important to us as an organization and a board to be good stewards of our members' and sponsors' money. That said, we are a small organization, so we have to make a little bit go a long way. We started the year with $54,854, and we ended the year with $46,295. Our total revenue for the year was $149,673. Our major sources of revenue were membership dues, credentialing, FTEP courses, and sponsorships. Our total expenses equaled $153,115. Major expenses included management services fees, paying down the credentialing exam development fees, software subscriptions, including those for OnShift, formerly known as Avesta, Examity, our online testing platform, and Your Membership, which is our website and membership engagement platform that we now use. Also, attendance at meetings and conferences, and marketing, including our periodical partnership with EMS Director magazine. I am happy to make the financials available to any member who wants to review them. And finally, it has been my honor and privilege to serve as NEMSMA's treasurer for this past term, and I am looking forward to continuing to serve as the association's treasurer for the coming year. Thank you.
Thank you, Allison. I didn't make mention of this earlier, but so Brooke, Sean came to us from his backyard in Colorado. Allison from Pennsylvania. I am in my omnipresent northern lights of Minnesota. The fact is that we only actually get to see this maybe once a year, but it's a pretty cool thing if you haven't seen Northern Lights. So we're going to move now to transition to our treasurer, to our secretary, Brooke Burton, who will give a report out on our recent elections and other issues related to her treasury report. So Brooke.
Hello, I am Brooke Burton, the NEMSMA Secretary, and I'm speaking today from beautiful Salt Lake City, Utah, with the Secretary's report. Despite COVID-19, or because of it, it's been a very busy year for NEMSMA. Through all the ups and downs, we've tried our best to maintain our meetings and commitments and work to improve our organization and your member experience. If you've not seen our new website, I urge you to check it out. We've been working to establish the site as a main networking and communication hub for NEMSMA, and we have big plans for the future. Please make sure to update your profile on the site with your areas of interest or specialty. Our goal is to provide the best leadership networking. If you need advice in fleet, quality, finance, or any other EMS specialty, we want you to have a network of self-identified experts to contact with a simple site message. I urge you to be a mentor to our members by networking on the site. If you're a new leader, I hope you will reach out to the amazing, knowledgeable people in our organization. We have also been working on other ways to communicate with our members, including newsletters, social media, and bringing back the ever-popular polling questions. You will see some new looks for those items in the months ahead. Finally, I would like to discuss our election. Due to being a candidate in this year's election, I was not personally involved with the process, but I am happy to announce the results. I appreciate your continued faith in me as I was re-elected to the board. Thank you. Jamie Chebra and Nick Nudell were also re-elected. Congratulations, Jamie and Nick. Chris Montero was the final member elected to the board, filling the opening left by Pat Songer after his transition to executive director. We wish a warm welcome and congratulations to Chris. All the newly elected board members will serve a 2-year term. We had an excellent list of candidates this year, which made voting very difficult. We really appreciate the effort made by the candidates and their continued contributions to NEMSMA in other roles. We also appreciate everyone who took the time to vote. We are your representatives, so make sure your vote counts. Thank you.
Pat, appreciate that, Brooke. Pat, haven't seen you on the line, but I want to just invite you, if you're there, to offer up your executive director statement. I'm not sure if Pat is on the line. Pat, are you there? All right, we're going to move on then. Jamie, I'm going to ask you to jump in here. So we have a number of committees within the NEMSMA portfolio, and Jamie Chebra is going to just summarize the activity of our committees rather than go through each one by one. Jamie.
Hey, Brian, thank you. And good afternoon, everybody from Jersey City, New Jersey, where the temperature on the street is about 112 degrees with the heat index. Quick update from the committee reports. And again, a lot of work's gone into a lot throughout the committees throughout the year. And this is just a quick, brief overview of what the highlights have been, but by no means is this meant to be comprehensive. So from Allison Bloom, who chairs our Committee on Accreditation. The Committee on Accreditation is currently in need of both a chair and a vice chair. The committee received 3 new registered leadership education provider applications and accepted leadership education sessions at 3 conferences over the past year. Although applications for accreditations have declined recently due to conference and program cancellations as related to the COVID-19 pandemic, the committee anticipates receiving at least a few applications for processing in the upcoming months. Also from Allison, she's very industrious, the Education Committee. The Education Committee has been busy identifying a cost-effective learning management system, or LMS, to deliver an educational content to our members as well as our industry. Simultaneously, the committee has been working to move our paramedic officer credentialing prep course to an online format. Although COVID-19 has caused some unexpected delays in the anticipated timeline, the committee hopes to be able to offer that prep course in an outline format before the end of 2020. And I'm going to ignore you, Mike Tegman, at this point. From Dr. Hezedine Smith, the Publications Committee. Over the past 12 months, the Publications Committee has been engaged in providing emergency services profession with information from various practitioners, scholars, and others. With that said, NEMSMA is committed to expanding our reach and penetration at a higher level by engaging knowledgeable and recognized contributors to be part of our Publications Committee. We've been joined by Mick Gunderson, Mark Price, Jamie Pisopsy, I might have butchered that name, who have agreed to contribute on an ongoing realignment of our communications. Recently, the NEMSMA board has agreed and approved the Publications Committee efforts to publish our own NEMSMA journal, which is pretty exciting. It's aimed at a more scholarly and industrial level appeal to a broader base of members. The official journal of NEMSMA will replace the EMS Director publication. NEMSMA has been sponsoring, the one that NEMSMA has been sponsoring over the last year. We're excited about our new direction and thank all of you who have contributed to our publications and initiatives in the past. From Nick Nudell, the IT Committee. In the last year, the IT Committee completed and has submitted recommendations for the Information and Technology Professional Credentialing. This is pending review by ACLI and submission for question development to the testing vendor. We are preparing to begin working on a white paper for the adoption of the Health Information Exchange by EMS agencies. A lot of exciting stuff going on there. Charles Blankenship from the Advocacy Committee. It's being led by John Surface and board member Charles Blankenship, along with the executive team, have been really busy this year. They've been pursuing support and funding for all EMS providers and agencies to be able to respond to COVID-19 and to maintain their daily responsibilities. We have sent letters and contacted legislators to point out some of the shortcomings of the CARES Act when it comes to EMS, and weighed in on a variety of related legislative issues at the national as well as state levels. They've been working on waivers and executive orders at a national and state level that allow for treatment in place and alternate destination, along with provider protections. We've partnered with other EMS organizations, advocates, and even sent our own letter to the president himself. I chair the membership committee, and I have to tell you that the membership committee is in an exciting state right now. We're in a period of flux, working to re-identify the value model for our members, working to bring more of a consistent and accessible value solution to the question of membership. Our membership numbers have flexed over the last year, but remain fairly static. The specific numbers are available on our website. And from Brooke Burton, from the Quality Committee, 2020 has been a very interesting year. And I have to mind you, this is a cut down version of her much longer presentation, which I encourage you to seek out on our website. 2020 has been a very interesting year. From June of 19 to today, our field has seen new developments that have changed our views on how healthcare interacts and performs. COVID-19 brought a whole new quote unquote normal to emergency medical services, with PPE shortages, changes in legislation, and changes in clinical practices. What we learned from these obstacles will help pave the new frontiers for EMS agencies, such as financial models for reimbursement and public health integration. For the NEMSMA Quality Committee, we have worked diligently to provide better pathways and methods of making quality practices accessible to every agency in EMS. The Quality Committee has been dedicated to developing new designs that will provide assistance to the quality managers seeking to support quality in their quality journey. A lot of quality involved in this committee, as you can tell. The NEMSMA Quality Committee has continued its efforts to establish partnerships with organizations for sponsorship of the quality credential test. Once funding is obtained, the Quality Committee will begin to work on the vetting of credential tests and prepare the exam for NEMSMA's Management Officer credential. The project has been a long time in the making, and once funding is established, the project can move forward toward completion. Again, this is just a précis of her overall report, which spans greater than a page and a half, and I encourage you to seek that out on our website. Sean Caffrey from our newest and most unique committee recently developed the NEMSMA Rural and Small Provider Committee. Was created in late 2019 as an interest group for both rural and small EMS agencies. The group is focused on networking and information sharing between services as developed as a list of topics of interest. Initial meetings also focused on existing rural EMS groups and projects. And while there's been a bit of a lull during the COVID-19 pandemic, the group has helped provide insight on rural EMS issues during the pandemic, and there are plans to return to a more regular discussion beginning in August. The committee currently meets the third Tuesday at 3:30 p.m. Eastern. And if you're interested, please contact co-chair Andy Smith or Jared Oscarson for more information. Pat Songer sent a report in the Provider Wellbeing Committee and Mental Health, and his report echoes the sentiments of everybody else working towards making a stronger provider relationship for our frontline providers during this COVID-19 pandemic, as well as creating more access to mental health services for the frontline providers. And Brian, that kind of sums up the committee reports that I received this year. I know there are a few more outstanding that will be made available on our website, and I do encourage the membership and those soon-to-be members who are on this call to explore that on our website. Does that cover the committees you'd like to discuss today, Brian?
I think so, Jamie. Thank you very much. I appreciate your report. All righty. So is Mike Pointner on the line? I don't see him on my screen. Mike, are you there? Okay, we're gonna go by that then. So for the group, benefit of the group, I want to introduce you to Dr. Kevin McGarvey. Dr. McGarvey is he's an ER physician by background, but he's also an entrepreneur and has launched the business of Hippo Health. And as one of our newest sponsors, we've invited Dr. McGarvey to make a few comments about his organization and his engagement with NEMSMA. So Kevin, thanks for joining us today.
Brian, thanks. As an emergency physician, and as many of you have likely experienced in the trenches as the tip of the spear, as was described earlier, our team felt the modern day healthcare experience was broken. We felt a large part of that was due to lack of easy communication between care teams in the community and patients. Our co-founding team were a team of emergency physicians, and we set out to solve for that problem by working on multiple telemedicine platforms, but found a universal problem that I, as a care professional, couldn't easily connect with my own trusted colleagues in my own community for coordinating care and referring patients for that last mile of care while seeing a patient virtually. So my group got acquired about 4 years ago, and I decided to make a leap of faith to try to build a solution that I felt met a need in the market for care delivery and for telemedicine at the time. We were able to launch our telemedicine platform this last year and started with our own care network in our own backyard. I'm here in Colorado as well. And we gradually signed up a few medical groups every month with about 25% paid user growth month over month. And then COVID hit and we had about 1,200% paid user growth in a period of 2 weeks. We were able to rapidly scale the platform, and we've had over 30,000 visits on the platform, as well as about 200,000 messages on the platform during the crisis of COVID. During that time, Chris Montera was innovative and forward-looking and wanting to partner with a telemedicine platform. We had the good fortune and honor to get to work with Eagle County paramedics to be able to start to demonstrate proof of concept of using telemedicine in the 911 setting, where patients in Eagle County were having transport times on average of 1 hour before COVID. During the COVID crisis in the first wave, in March, April timeframe, their transport times went up to 2 hours with gowning up, gowning down, decontaminating equipment and PPE. And then with our platform, we're able to help them start to assess patients in 10 minutes in the 911 system. We're now looking to partner with innovative EMS agencies across the country that want to start to push the envelope and really develop community paramedicine programs that are integrated in depth with local clinics, local virtual care teams, to really look to reinvent the modern day care experience. We truly believe that EMS as a profession is in a position to lead healthcare and care delivery, and would be honored and humbled to work with any EMS leaders that are looking to use a telemedicine platform and start to collaborate with a clinician-owned and led company that's technology-based. So thank you so much for inviting me to speak.
Well, Kevin, we're very grateful for your support, not only as a sponsor of NEMSMA, but of the work that you're doing in the career field. It's pretty innovative and pretty exciting, and touching a lot of people's lives. So good for you. Way to go. Appreciate you.
Thank you.
Thanks very much.
Hey,
So,
Brian.
I just wanted to check back. Chris Montera, we wanted to introduce you as our newest board member and give you an offer an opportunity just to say hello to the folks on the audience, and any comments you might have to offer. Are you there, Chris? I saw you a minute ago. I don't see you now. Okay, we'll come back to you if you're there. Okay.
Hey, Brian.
Oh, go ahead.
While we're waiting for Chris, I believe we have a message from Pat Songer, Executive Director now.
Thank you, Anthony. Appreciate that.
Sir.
Welcome to NEMSMA's annual meeting, and thank you for joining us today. It's exciting to have so many of you join us during these unprecedented times when you all as leaders have such a heavy burden. After a year serving as NEMSMA's intern executive director, I'm honored that the board has confirmed my position as their permanent executive director. The future of NEMSMA is bright. We have exciting changes coming throughout the next year as we work to improve upon the value of being a member in NEMSMA. We are excited to work with each and every one of you to determine the value equation that NEMSMA needs to bring to its membership and improve upon that value equation. One of the best parts of being a member of NEMSMA is the value of the relationship. NEMSMA is an organization filled with leaders from across the country whose greatest power is the power of the relationship. We are proud to be able to connect leaders with leaders across the country to collaborate, provide guidance, and sometimes provide a comforting shoulder, especially when the burden upon emergency medical services has never been so great. Leadership is about the relationships, and NEMSMA is proud to support our members with pathways to connect, support, and develop leaders. Please keep our EMS family safe. The burden carried by all has never been so great. The impacts of COVID will be long-lasting. As leaders, we have the ability to help with that burden. We can navigate our providers to resources that provide solutions. NEMSMA is happy and honored to be able to help leaders provide solutions, provide education, and provide pathways to expand upon leadership. If NEMSMA's board members or myself can help in any way, feel free to reach out at any time. I'm looking forward to the future of NEMSMA, and I'm looking forward to the future of EMS in this great country. My personal cell is 775-304-0416. It would be an honor connecting with any of you at any time and providing any help that I can. Stay safe and keep our providers safe. Thank you.
Pat, thank you for those comments, and you just make me think and I'm so proud of this organization and the leadership of folks such as yourselves. You are so genuinely passionate about the advancement of the career field and supporting our caregivers across the country. So thank you for that. So Matt, if I could offer up this back to you from Fitch, I think that this would be a good time to hear Dr. Fauci's closing comments.
Brian, before I do that, I actually do have a recorded message from Mike Pointer, if you'd like for me to share that now.
Oh, thank you. I appreciate that. So Mike Pointer is the executive director of the Kentucky Emergency Medical Services Board and a former board member of NEMSMA and a very active current member. And he's helped us prepare and plan for this event today. So go ahead, please.
Thank you and good afternoon. My name is Mike Pointer and I currently serve as a commissioner on the American College of Paramedic Executives. The commission consists of 13 members appointed by the NEMSMA board on a staggered 3-year term. We currently have 3 credentials that we certify in, the first being the Supervising Paramedic Officer or SPO, the second is the Managing Paramedic Officer or MPO, and the last being the Executive or Fellow. All of our certifications are based on the 7 pillars of competency, which you can find at our website at www.nemsma.org. Across the nation, we've got over 21,000 EMS organizations and over 800,000 EMS providers, and they all deserve good leaders. With this program, we're offering the opportunity to allow individuals to step up and fill that role of a good leader. We currently have 58 supervising paramedic officers that are certified, 58 managing paramedic officers, and 77 fellows. We currently partner with OnShift to help provide us with the technology to assist us with the training and certification. Some of our future goals include a separate prep course for each level and more online training opportunities. So with that, I will conclude my report and invite you to go to our website for more information. Thank you very much for your time.
Thank you, Mike. We appreciate your report. So we are nearing the end of our scheduled agenda. And I think I'm just going to invite Matt, our coordinator from Fitch and Associates, to share Dr. Fauci's message with us.
Warm greetings to you all. My name is Tony Fauci, and I am the director of the National Institute of Allergy and Infectious Diseases at the National Institutes of Health in Bethesda, Maryland, and a member of the White House Coronavirus Task Force. I am delighted to have this opportunity to extend my deep gratitude to the National Emergency Medical Services Management Association and to all EMS workers around the country for the extraordinary contributions you have made to the United States public health response to the COVID-19 pandemic. Your competence working on the front lines during the initial terrible surge of infections and deaths that overwhelmed hospitals and nursing homes to the current resurgence of cases and hospitalizations that certain regions of our country are experiencing today has been truly remarkable. Under extremely difficult conditions and at great risk to your own health, to bravely do your job day after day while caring for patients with a novel and highly transmissible pathogenic virus is an extraordinary demonstration of selflessness and compassion. To my mind, your courage and commitment are genuinely heroic. I am profoundly aware that this arduous fight to protect yourselves, those you love, and your communities has likely caused many of you to feel mentally and physically exhausted. Please hang in there. Now more than ever, we need your resiliency. Here in the United States, the COVID-19 pandemic remains a serious problem. A staggering number of lives have been lost, and many more who have recovered from the coronavirus infection suffer debilitating after effects. Americans initially came together and successfully flattened the curve, which enabled hospitals to survive the initial surge of infections at the beginning of the pandemic. Subsequently, however, several areas of our country began reopening prematurely in an accelerated fashion or had citizenry that did not adhere to guidelines before those areas had reduced the pool of infected people to a low enough level that community transmissions of the virus could easily be brought under control through the containment measures of identification, isolation, and contact tracing. Consequently, certain parts of the country are now struggling with alarming resurgences in cases. Our country is large and diverse, and thus solutions must be tailored locally. I am hopeful that with the guidance provided by your states, cities, and communities, and the sustained discipline required of us all, we will, as a nation, gain the upper hand over this pandemic. However, now is not the time for complacency. Rather, we must intensify our efforts, since our job certainly is not done. We also must remain vigilant in the face of future uncertainties. We do not know how the pandemic may further evolve or what its ultimate impact will be, especially as we head into fall and winter seasons and the return of seasonal influenza. Although our country's return to normality will be neither fast nor easy, we can be encouraged by the comeback that occurred in states such as New York and Massachusetts, which reduced community transmission of the coronavirus from very high to very low levels using the public health tools we have in hand. Public health endeavors are the pathway, not the obstacle, to economically reopening our country. Heartening progress also is being made on the scientific front. In this regard, large-scale efficacy trials of several promising COVID-19 vaccine candidates developed in record time are starting to be launched. Although one can never guarantee success in vaccine development, I am cautiously optimistic that we will have a vaccine by early 2021. Clinical trials of multiple different treatments, including monoclonal antibodies, convalescent plasma, and hyperimmune globulin, may yield results even sooner. Unquestionably, we in the United States are at a critical moment in our response to the COVID-19 pandemic. Now is the time for everyone to dig deep and summon their resolve by adhering to the simple practices we know work to protect ourselves and others until we have the medical tools in hand to effectively treat and prevent this disease. Face coverings, physical distancing, avoiding crowds, and washing your hands. Together, we can do this. We can end this terrible scourge. And so, stay safe, and please look out for one another. Thank you again for your service in protecting the health of your communities and our country. And I wish you all the very best.
So, Brian LaCroix here again. I want to just acknowledge a couple things. I explained how that came to be that Dr. Fauci shared that message with us. But what I didn't tell you is that he actually sent us two different messages. He sent us an initial one, which was shorter and a little bit more, I don't want to say upbeat, but a little bit more positive. And then just the other day, I got another email from him saying that as things have evolved, he wanted to emphasize a bit more about the circumstances we're in. And frankly, I think that it's not lost on any of us who watched the video. He looks fatigued, personally. He looks tired. He looks like he's been having a lot of hard work going on in his world, and he has. So regardless of your politics, I think that Dr. Fauci is deserving of our gratitude in his leadership of this pandemic around the country. And we as leaders of EMS organizations have, I think, an obligation to take his simple advice around face coverings, social distancing, and hand washing. These are not difficult things to do. And I think that we have an opportunity to help encourage our staff, the people around us, our families, friends, and our social connections to encourage them to do the same to help us get through this pandemic. So much gratitude to Dr. Fauci for both the work he's doing and his taking time out to send us that message. So I'm very grateful for that. I am looking through the chat room, see if there's any questions that need to be addressed here, and I don't think so. I want to offer my thanks to Matt Doherty from Fitch & Associates for his help on the technical side of providing the platform and making this whole interactive virtual meeting work for us. And with that, I'll just take a pause, and any of our participants have any questions or comments that you'd like to get on the table before we conclude? Sean, as president-elect, I'll look to you. Do you have anything you'd like to add?
I don't, Brian, but thank you very much to everyone who attended. And if you're not yet a NEMSMA member, we hope you will consider joining, and everyone stay safe out there.
There you go. And again, a special thanks to Dr. McGarvey and Hippo Health for their recent sponsorship. And we look forward to a mutually beneficial relationship. Anthony, thanks so much. Anything you want to add?
Yes, sir. Thanks, Brian. It was so great of Dr. Fauci to take time from what has to be an incredibly busy schedule to bring us that very, very important message. I know it's greatly appreciated by everyone here today. And again, thank you, Brian, for your leadership at NEMSMA, and to the executive director, Pat Songer, and all of the NEMSMA board and the committee members for the important work you guys are doing for the advancement of our industry. Also, thank you to everyone that attended this year's annual membership meeting. If you're not a member, we hope you'll consider joining NEMSMA, learning how you can participate in this important work that these folks are doing for the advancement of EMS. You can visit www.nemsma.org to find out more information on everything that they're doing and how you can become a member.